All right, we are live with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you for joining us again, Doctor.
Hi, and good afternoon.
Good afternoon. My name is Dilshad Burman. I'm a web writer with CityNews and 680 News, and I will be moderating this chat today. We have been getting questions for the doctor all week on our website and on our social pages. If you haven't had a chance to submit your questions, you can still do so in the comments under this live feed, and we'll try and get to as many as we can. So, Doctor, are you ready to go?
Yeah, you know what, I wanted to follow up on one question from last week. There was the question about the key in the app. So the COVID-19 app is something that's free. It's available across the country, and it can help with contact tracing. And there was a question last week about what does the key mean? And so if you go and get tested and you test positive, when you get your results, there will be a key associated with your result. And you will put that key into your app, and it will anonymously notify those people who may have had close contact with you to notify them that they should consider watching their symptoms or get tested for COVID. And so that's what the key of the app refers to. So I wanted to follow up on that.
Okay, wonderful. Because I think the question was, if you get a key, are you positive? And so I'm assuming that with a positive test comes that key that then you can, like you said, put into the app.
That's right, yeah.
Okay, wonderful, okay. So let's get started today with a couple of questions regarding seniors. Shale asks, do you know when fitness programs for seniors can start indoors? I work for a senior center and no one is giving us a straight answer.
So we actually have guidance on our website related to fitness centers. We also have guidance related to older adults. And so please go to our website if you're working with these groups, and feel free to call us if you have any specific questions. There is no restriction on having fitness centers or activities open for seniors. Because seniors are at higher risk, we do recommend that they take additional precautions. And so to make sure that in the class, everyone is physically distanced, wearing masks, before or after you're doing extensive cardio. If you're not doing extensive cardio, then to wear a mask, for example. And then we have a guidance document for seniors themselves so that they know what precautions they should take. They may choose not to do an indoor class because it does have a bit of higher risk. And so I think that's a question that every senior themselves can answer as well.
Okay. And then Boo asked, when visiting seniors' long-term care homes, is there a concern for transferring the virus on gifts like flowers or food items or fresh fruit?
In general, we don't think that the virus transmits very easily on packages. That's why we don't recommend when you bring your groceries home that you have to wipe the groceries down. I think the most important thing is that if you're bringing, first of all, you should find out from the home whether you're allowed to bring these things. They may have certain policies. If they say it's okay, then I just think the important thing is to wash your hands before you touch these things. If you put them down somewhere in a bag or whatever, clean the surface that the bag was touching, and then make sure that if the person in the home who is touching these things, that they wash their hands before and after touching them.
Okay. Couple of travel-related questions. Veshak asks, his mom has booked tickets back home to India, and she's on a visitor visa here. Is it possible for her to do a COVID test in Toronto, even if she doesn't have an OHIP card because she's a visitor?
Yes, so you can go to an assessment center. OHIP number is not required to be tested in Ontario.
Okay, and it's just basically free for everybody? Everybody gets a test?
That's right, because we actually want everyone who may have symptoms to get tested. The recommendation would be that you go to get tested because you have symptoms or because you've been in contact with someone, and you would be eligible to get testing in that situation. The testing guidelines have changed, and so the guidelines to test everyone, anyone who wants a test, who thinks they want a test, that has changed. We're moving away from that. And so if it's the case where she has no symptoms and she needs a test to go traveling, you should call the assessment center first to see if she would be eligible for that particular situation.
Okay. And sorry, you mentioned that the testing guidelines have changed. Recently, there was a push for everybody to get tested. How have they changed now? Is it only for symptomatic people?
That's right. So people who don't have symptoms right now, a majority of people who don't have symptoms that are being recommended for testing are if you've had close contact with someone who had COVID. But otherwise, if you have no symptoms and you just want to get tested, that is not part of the testing guidelines right now. There is a bit of latitude, and so you could talk to your provider or the assessment center if you have a specific situation, though, if you're part of a certain related to your work, if you need to get tested, if you're going to get tested because you want to visit someone in a long-term care home, for example, there are other reasons why people without symptoms could get tested, but it's moving away from anyone who just feels like getting tested to get tested.
Okay, good to know. Then there's Acer asks, I am on my day 2 of quarantine upon arrival in Canada. But if I get tested for COVID-19 and the result is negative, can I go back to work immediately without finishing the 14-day period?
No, you cannot. You are required under the Federal Quarantine Act to complete that 14-day quarantine. Whether or not you get tested in there, we are not recommending that you get tested if you have no symptoms. If you have even one symptom, please go and get tested. But even if you get a test, say at day 5 and it's negative, you are still required to complete those 14 days. That is very clear.
Okay. And then the ever popular question, Mo asks, when will the travel restrictions and 14-day quarantine be lifted?
Right now, they've been extended again until September, and so we'll have to see on a month-by-month basis. We do know that it is helpful to keep our numbers under control and to slow the spread. We are actually seeing that people who are traveling are coming back and are getting COVID. So for those essential travelers who are allowed to travel and are coming back, maybe people who live around the world and are Canadian are coming back, we are seeing travel-related cases. And so the risk related to travel is still there. Okay.
Couple of work questions, actually. Alwyn asks, as employees are returning to work, should air conditioning systems be fixed with virus purification filters because ACs circulate the same air? And would that maybe become mandatory to sort of modify the existing AC systems?
So there is no virus-specific filter or anything that needs to be done. We're telling buildings, schools, if they have an HVAC, so heating, ventilation, and air conditioning system, that there are modifications they can make. So they can put in a high-efficiency filter. They can increase their air exchanges from inside to outside to help increase the air circulation, but there's no specific virus filter per se.
Okay. And then Alan asks, do workers have the right to know who tested positive within their workplace? Is that something that should be known to everybody?
No, workers do not have the right to that. They have a right to know what their own risks are, but because of privacy legislation, if someone has COVID, they are allowed to keep that personal health information secure. They're not required to share with everyone that they have COVID. And so the role of public health, we know who the person is who has COVID, and we do our assessment, make sure that we have a thorough assessment. If we can't do that, if there are gaps, then we will be more conservative. But the actual ability to know this person had COVID, that's not considered a routine part of our investigation. And it's certainly not something that anyone is entitled to know.
Okay. Couple of questions just regarding the virus itself. Anxious Me asks, I was diagnosed with cancer 2 years ago and a surgery was done. I'm currently not receiving any treatment. Am I considered as having an underlying medical condition or high risk that would make me vulnerable to COVID-19?
So I would suggest that you talk to your doctor about it. They would have a better sense of your full medical history. We are finding with COVID that even one chronic health condition like high blood pressure can put you at higher risk. It's not clear what exactly that relationship is. So, the fact that you've had cancer, you've had surgery, and now you're in remission, the question is, do you have a weakened immune system? Because of all of that, that might put you at higher risk just for that alone. Mm-hmm. So I would ask that specifically to your doctor, who could review your whole file.
Okay. And then this one, we've addressed this before, but good to ask again. Do people have immunity from this virus once they have it?
They probably have a bit of short-term immunity. How long that will last, whether it's a couple of weeks, a couple of months, a couple of years, or for life, that part we're not clear on. It doesn't seem that people who have had COVID are getting COVID again, but again, our window is so short. We've only known about the virus since December. We only have 8 months of experience. And so, but we are, every time we get a case in someone who has symptoms who previously had COVID, we're trying to unpack whether this could be a new infection or whether it's something else causing their symptoms, for example.
Okay, definitely wait and watch again, because there's so little we know right now.
Yeah, and I think also it's worth mentioning that even if you had COVID, you should still take precautions, because we can't definitively say you can't, that you're immune.
Absolutely. So this is an interesting question. Joe asks, this virus has been creating blood clots in people that have the virus and have recovered. Was there any other virus that has been documented to cause this kind of reaction?
We do know that when you get a severe infection, something called sepsis, so a blood infection, that can cause, it can actually cause multi-system disease, can affect your organs, and that intense, very serious infection can put you at higher risk for clots. So whether it's a marker of exactly this infection or whether it's a marker of having a severe infection that's affecting your whole body, I think those are the kinds of things that we'll have to tease out.
Right. So severe infection itself can also lead to blood clots. So it's not necessarily just COVID, like you said.
Yeah, and one of the other things that makes you more prone to getting a blood clot is being inactive. And when you have a severe infection, if you're in the ICU, intubated, you're not moving your arms and legs, and that can put you at a higher risk as well.
Okay. And then now we have a whole bunch of mask questions coming in today, so I've grouped them all together. So let's get into our mask questions. Firstly, Marina asks, do I need to wear a mask under a face shield?
If you are wearing a face shield, the face shield alone will not provide you protection. And so the mask is more important than the face shield, absolutely. So if you want to wear a face shield, that's fine, but first put your mask on and then put the face shield on.
Okay. And then Minnie asks, how can we protect young children from the virus when they can barely manage their days, let alone wearing masks all day?
Yeah, it's a good question, and I think that's why we have to actually modify what we do with young children. And it means that perhaps we don't take them to certain places, recognizing that they might not be able to keep a physical distance. And so I think we have to keep in mind the stages of development for the different ages, and not put children at higher risk because they can't maintain that distance, for example.
Okay. Caitlin asks, could you explain the importance of wearing a mask in condo or apartment shared spaces? She says that in her building, compliance is barely 50%.
So there is a new bylaw that was passed that requires that building and condo owners or management have a policy for mask use in common areas, which would include a front area, laundry room, elevators, for example. And so there should be signage posted, and the building management or owner should have a policy. And so in the policy, it should be defined what they are recommending for people who are not wearing masks. So I would suggest you follow up with your building management or condo management to see what is in their policy and to work with them, because the goal is to get mask usage high. There are exemptions, but the exemptions should be quite small, and most people should be wearing masks in those situations.
Okay. Jim asks, why are some male healthcare workers allowed to keep their beards when it's proven that masks need direct contact to the skin to be effective? So
if you're wearing an N95 mask, so in a healthcare setting, you need a really good seal around. And in those settings, you need to actually trim your beard. But for our cloth masks, it needs to be without gaping, but it's not creating a real seal. And so that's why in a non-healthcare, non-N95 mask setting, the beard can be allowed.
Okay. Matthew asks, do we have to wear a mask at an indoor pool while working?
You have to wear a mask in indoor settings, including in recreational facilities. If you're swimming or in the water, there are exemptions for wearing masks. If you're behind a plexiglass, if you're in an indoor pool setting that's only available to staff, then you would be exempt. But otherwise, if you're at a front desk, if you're a lifeguard, a mask would be required in that situation.
Okay. And then Tayalan asks, apart from wearing a mask, gloves, goggles, etc., is there anything else we can do to prevent the spread of COVID-19?
So actually, wearing masks, gloves, and goggles are actually personal protective equipment, and they alone will not help us to prevent the spread. Actually, what's probably going to be more effective is 6 feet physical distance, staying home when we're sick, keeping our social circle to 10, and not having large gatherings, especially in indoor settings. I mean, there's a lot of other public health measures that will help us to reduce the spread beyond the mask, gloves, and goggles.
Absolutely. And then John asks, how do we check if Canadian-made surgical masks or procedure masks are legitimate? Is there any public health recommendation for a particular brand or particular type of mask?
So that's a good question. I was actually looking at the masks that we have available in the hospital and trying to actually answer that question for hospital use. There is a grading system for masks, for medical masks. And so that is available, and you can check masks to see if they have that grade on there. For non-medical masks, there is no grading system that I'm aware of. And so what you want to do is look at the mask to see if it's durable. Is it made up of more than one layer? Again, the disposable non-medical masks, we're not quite recommending. We still are recommending the cloth masks because you can get the 2 layers. They're as effective as a non-medical mask, and you can wash them afterwards and reuse them.
Right. Okay, so that's all the mask questions. Let's move on to a couple others. Concerned patient says, my optometrist washed her gloved hands between patients instead of using new gloves. Is that acceptable?
No, that is not acceptable. And that's why in our guidance, we're actually not recommending the use of gloves, because gloves, people think that they can wash their hands with gloves on, and you absolutely cannot. To use gloves properly, you have to wash your hands, wait for them to dry, and wash or sanitize your hands, put the gloves on, do whatever you're going to do with the gloves on, and then take the gloves off carefully, wash your hands again, and then do it again if you're going to wear gloves again. But you actually cannot keep your gloves on and wash them and think that that is safe. It's better to have no gloves and wash your hands in between.
Okay. And then Paul asks, my question relates to churches and their reopenings. If the church is observing social distancing and wearing masks, why are they not allowed to sing?
We are waiting for updated guidance from the Chief Medical Officer of Health on places of worship. We've had this question a lot, and we feel for people in places of worship. We are waiting for the go-ahead to be able to provide guidance. But right now, the guidance is that you cannot sing in these places. I can say, if we look at in restaurant settings, you're allowed to hire performers. If you hire performers who sing, they must be behind plexiglass. Each performer must be 6 feet apart. So there are a lot of measures that have to be put in place in order for singing to be allowed currently right now. And in restaurants, when they have performers who sing, the maximum capacity indoors is only 50. And right now at places of worship, the capacity is 30% of the room. And so I think we need to take these things into account when grading, so you can have more people in a place of worship. So that means what you do there has to be lower risk.
Right. And singing, as we've discussed before, is high risk because the chances of your droplets spreading that much further with that much force is higher.
That's right. And if you're singing with a group, not maintaining that distance can also put you at risk as well.
Absolutely. Okay, and you actually did mention restaurants right now. So Rob asks, can you explain the difference between having social distancing rules in restaurants and stores, but not in schools?
So Toronto Public Health has come out very clearly to say that a physical distance, a social distance of 2 meters as much as possible is a recommendation in schools. And we have not changed that recommendation. That is our recommendation for classes, for cohorts, for schools, as much as possible. And where it can't be maintained, then we take additional measures like wearing a mask and that kind of thing. We do have a guidance document on our website. We've labeled it for non-publicly funded schools. The reason why we've done that is because we've provided the same guidance to publicly funded schools already, so we don't have a published guidance for them. But we are clear that in schools, we do recommend physical distance as well.
Okay. And then KS asks, can smoking affect others if an asymptomatic person's smoke or secondhand smoke is inhaled by another person?
So I guess the question is, are there droplets in that smoke? And
yes.
So if you're inhaling someone else's smoke, it probably means that you're closer than the 2 meter distance. And so, yes, then that would be, whether it's actually in the smoke or whether it's because you're close to them and you could get the droplets, I would not recommend that.
Right, absolutely. Okay, Malik has a question about testing and what markers we're looking for. He says, yesterday, Ontario reached a 7-day average of 0 deaths per day, and only 32 people are remaining in our hospitals that have tested positive. So what exactly are we looking for before we can say that COVID-19 is in the past? There has not been 1 week of net increase in hospitalizations since April. So is that not enough to say that we are past it?
Well, we continue to get cases every day in our city. We have not had a day where we have had 0 reported cases. Every day there are new cases that are reported. These are new infections. Most of them are people who live in the community who are getting infected. More than half of them are getting infected from a close contact, but others are getting infected from travel, from other places. Yes. And so we can't say that COVID is no longer in the city, we're doing well. I mean, the hospitalizations are low, the deaths are low. We're on the right path, but we continue to still have spread in our community.
Absolutely. And then Michael says, we have been told repeatedly that testing is only effective if the results come back in 24 hours. So how old are the tests that we're getting daily for Toronto and Ontario?
So we have this measure on our website. It's called our monitoring dashboard, and one of the indicators are that we get 60% of our tests within 24 hours, and we have been doing good at that. It's slipped a little bit below. I think the reason why getting tests back so quickly is important is because then we can do our case and contact follow-up right away. But even still, if you've been tested and you have symptoms, you should be self-isolating. So even if it takes an extra day or two to get the results to public health, you won't be spreading your virus to others.
Okay. Alex says, we hear that children spread the virus but don't necessarily get very sick from COVID-19. Is it possible that we just don't know how much it's going to affect children because schools were closed early on and children weren't really exposed? So how can we be really sure if children are not going to get a severe infection?
I have the same questions as you. Yes, I mean, I think we've seen because schools were closed, kids were not likely to get infected. We are seeing now, though, that the proportion of children who are getting infected is increasing. And so previously it was, less than 10% of kids that were getting infected. Now it's about 17% in the last month in Toronto. So what we do know based on the review of children getting infected around the world is the younger children are more likely to have a less severe infection. But we do know that while rare, some children can get that very serious inflammatory condition. So all we can say is this is what the data shows right now. But just like you are, we are being cautious in what we say about this. We can only say what we know right now, and we're continuing to monitor it for the impact on children.
Okay. And then sticking with kids and going back to school, Bridget asks, has there been any thought given to the amount of chemicals that children will be exposed to because of the repeated cleaning and disinfectants?
So the cleaning and disinfectants that are required in schools are approved by Health Canada, actually. So Health Canada has done a review to ensure that they're safe to use. I mean, they're certainly recommended to be used in a certain way. And so it still is important that we wash our hands so that if we have any chemicals on, we're washing that off as well. You know, and that we use the disinfectants in the proper way so that they will be safe to be used in school.
Okay. Trace asks that they've heard that a vaccine might only be 50 to 70% effective. Why is that the case?
Well, you know, until we have a vaccine, until we do studies, we won't know how effective it will be. We know something like the flu vaccine is on average every year about 50% effective. So even a vaccine that's 50% effective can provide protection and good protection compared to a vaccine that's, say, 90% effective. Obviously, we want a vaccine that's as protective as possible. The reasons why a vaccine might be less protective, there's a number of reasons. One is, maybe if you're older and you get the vaccine, you're less likely to develop that immune response. And so it still is not likely to fully protect you, but maybe it might make you less sick from the virus, for example. Or it may be that what the vaccine, this particular protein or gene that the vaccine uses might not always be the one that infects you. We see that with the flu, that the strain can change. And so those may be all reasons why a vaccine may not be 100% effective. But even at 50% effective, we can still find benefits as we do with the flu vaccine every year.
Right, absolutely. 50% is better than 0% for sure.
That's right.
For sure.
Yeah, yeah. But let's hope. I mean, right now we don't have any vaccine, and so it's. I don't want people to think that okay, the vaccine that comes out is going to be 50% effective. We don't know right now.
Right. And on that note, actually, I guess we get this question a lot, and I don't know if we really have an answer yet. But how long, basically, till we can get an effective vaccine?
Yeah, I mean, there's a lot of movement that's going on in the vaccine world. There are places that have moved into what we call phase 3 clinical trials. So it's nearing the end of being able to study the vaccine in people to see whether the vaccine actually helps to prevent the infection. And so we are certainly closer than we were even a few months ago.
Right. Actually, we have another mask question that just came in right now as we're doing this live. Who is responsible to enforce masking inside apartment buildings with the city bylaw?
So the requirement is that the condo owner or apartment management have a policy in place for mask usage. And as part of that policy, it would talk about what they would do in situations where people are not wearing masks, where people have exemptions, for example. So I would go back to your condo owner or building manager to ask what is the policy that they've developed for mask use.
Okay. And then I guess this one is slightly simpler, but Mary asks, my next door neighbor keeps coughing when I'm outside in the backyard. Should I be worried?
If your next door neighbor is 2 meters or less close to you, then I mean, that could pose a risk to you. If they're further apart, it will be less of a risk. And so, you know, you could wear a mask to further protect you as well and keep your distance.
Okay. And then let's see, John asks, in terms of the immune system helping out your body during this pandemic, what have we done to sort of encourage people, to increase their immune system or build up their immunity? Has there been any education on that front?
Well, we know that there are a number of different ways that you can build your immune system, actually. Getting exercise might be one, eating the right foods, looking after your health in general can help with your immune system. So, I mean, to the extent that we've recommended people go outside, be physically active, look after your mental health and your physical health, we think that those things will be helpful to build and boost your immune system as well.
But when it comes to being immune to COVID-19, at this point, we don't know if there's a section of the population that is just immune to it or has had it and then built up immunity. That's not something we know for sure.
We know based on the studies, the antibody tests that have been done, that about 1% in Ontario, slightly more than 1% of people have immunity likely because they had COVID. So it's a very, very small percentage.
Very small percentage. Okay. And then let's see. Ed asks, the Health Canada website shows clearly that only 2% of Canadians tested for COVID-19 are testing positive. So are the rest of the people who are sick with something else, or is it also?
That's right. So yeah, so what you're describing there is a percent positivity rate, and so it means the people who are tested, those are the ones who are coming. Only 2% of all the people who are tested are coming back positive. And in general, if we see the percent positivity rate of 10% or higher, it's very high. It means that COVID is probably circulating. We saw that in Florida, for example, places like that. It means that all of the other people who have symptoms and are being tested, yes, have something else. Maybe it's seasonal allergies. Maybe it's another viral infection.
Okay. And then we have time to squeeze in just one more. Last week, we talked about classroom cohorts and how the teacher's social bubble is not the same as a classroom cohort, and it doesn't mean that the teacher's bubble has been extended. When it comes to the students then and the cohorts that they are in, is that the same for them as well? It's not the same as their social bubble with their family. It's a separate sort of group that they're interacting with, but with layers of protection.
That's right. So the cohort or the classroom that they're in it's a type of bubble. We're calling it a cohort. We're asking that students keep that distance as much as possible, wear a mask, that they, again, use those layers of protection, compared to in your social circle, where you would have 10 people who you can keep that. You don't need to be worried about that distance. You don't wear masks when you greet those people. They're in part of your household, and that's part of the distinction there.
Right. Okay. And I think that's a really important distinction, because a lot of people, the questions that we've been seeing over the past weeks, people are very worried that those bubbles are being extended. Whereas I think the main difference is in the bubble, you don't use protection. You can hug, you can love, you can do all of that. Whereas when you're talking about a student cohort, there's still protective measures that are taken, so that doesn't become your bubble.
That's right. And so we're saying in the bubble, if you want to greet your friend, wave to them or say hello rather than give them a hug in a classroom setting.
Right. Absolutely. Okay. Well, that's our time for today. Thank you, Doctor, again, for taking the time to answer all of these questions. And next week, we are so close to back to school. So we're going to be asking the doctor to answer all of your back to school questions. Keep them coming. We'll try and get to as many as we can. Thank you again, Doctor.
Okay, bye-bye. Have a good week.
Bye-bye.